Good morning, good afternoon, good evening, wherever you are. How are you? Welcome back once again to my channel. And today I want us to talk about what the community needs to know about the children's oral health or the children's teeth. There are some things that we need to know that in case we know, our children are going to have good teeth and good oral health. Number one is that one thing is about caretakers. Caretakers, I mean mothers, maids, relatives, the one that stay at home with our children. First of all, these children are always close with these caretakers. Sometimes we leave them with the children, they give them sweets, they lick and they share sweets, food, even sometimes toothpastes or toothbrushes, which can spread infections, for example, syphilis, and specifically now in my department or in my specialty, dental. We have a problem which we normally had in the village, or which even some parents right now practice of splitting or breaking medication. Maybe someone is going to give him a paracetamol tablet, he puts in their mouth, breaks. You are using your oral cavity with infections, maybe you're passing it to the child. That one is very bad. You're spreading bacteria, you're spreading infection from your mouth to the mouth of an innocent child. Another one is about syrups. Syrups are good. Doctors are always going to give us syrups to cure diseases of our children. But after doing that, after giving syrups, when you give a child syrups which are good and of which is helping the child to cure a disease that is affecting the child or any infections, you need to brush the teeth of these children. If at all a child has 2 or more teeth, we need to brush. Sometimes a child has just 1 or 2 teeth. You can gently get a gauze or a clean sponge. You just clean and rub on the teeth in order to reduce the sugars that are in the syrups on the children's teeth. Because these sugars, they affect the child's teeth, they will end up having tooth decay. Another point which is normally not taken care of, which is very important for us to know, is feeding children at night. Many of us parents and many people normally give children bottle at night. Bottle feeding is very bad because it increases children's sugar levels in the oral cavity. You need to reduce sugar levels in the oral cavity because when someone sleeps, there is reduction of saliva, and saliva is very important in the child's mouth because it dilutes the sugars which might have been maybe in food or in the sweets during the day. But when the child is sleeping or night, when it is night, it is going to have nothing to dilute the sugars. Therefore, I urge all parents, at least give water, warm water at night. If at all you cannot give a drink without sugar, it will be very good. Another one which is very important to note in most of our tradition or in our culture is rewarding children. We always reward children. You give a reward when a child has done something good, which is very good. But I urge parents, if at all you want to reward, you reward by giving foods which are not affecting their teeth. For example, many of the parents give sweets, give biscuits. These ones are very dangerous for our children's teeth. So I urge you to give things which are not harmful to their teeth. For example, you give apple, you give food you give them appreciation in terms of things which are not very dangerous. Another one which is almost similar to that, but which is really done in many of our homes, our schools, our communities, is birthday celebrations. We normally like our children to go for birthday celebrations. We buy them sodas, we buy them sweets, we buy them cakes, we buy them all those things. In medical, we call them cardiogenic. In other words, they have a higher chance of causing dental caries or tooth decay. Therefore, whenever we go for birthday celebrations, we need to tell children to brush their teeth immediately. You may not stop them from having a cake, but you need to tell them to brush their teeth or to rinse their mouth before they go to bed. But you should regulate the time and intervals of these parties because they are affecting their teeth. We have others which, another habit which of course children do, that is thumb sucking. Thumb sucking or finger sucking is very bad, because the moment somebody does thumb sucking, it's going to push these front teeth, the upper teeth will be pushed in front and the lower teeth will be pushed inside. By that, you shall find somebody having an open bite. An open bite is a situation where someone bites the teeth, but the front area or the front teeth do not close because of the thumb that was doing what, that was pushing them, as I have explained. So this one is very bad habit. But I urge parents to tell children in a very good way. Tell them how dangerous this habit is. Don't force them. Don't put kamurale. Do not harass them when they are doing them. Don't embarrass them in the community. Explain to them. Tell them the effect, how it is bad, and in so doing, they shall be helped. But in case it has been done, we need to seek a dentist who will use all methods to make sure the child's teeth are in order. We have another problem of bruxism. Bruxism, some children, when they are sleeping, they grind their teeth. Sometimes it is not their intention, you may not have to blame them, but it is involuntary grinding of teeth. This involuntary grinding of teeth you need to seek dental treatment where we stop it, or we stop the effect on the teeth. Because the moment the teeth keep rubbing on one another, they remove the upper part of the tooth, the one we call enamel. The middle part of the tooth, which we call dentine, is exposed, which makes them more susceptible or more likely to be damaged by the sugars. Then another which I want to talk about is we normally neglect dental care. You find somebody has done everything, but you normally neglect dental care. Even some doctors, they feel the children's teeth should not be minded about. But you need to know that for a child, their teeth are also important. They also need to smile with their teeth. They also need to laugh. They also need to sing. They also need to boost their self-esteem. So not all the teeth should be removed. The teeth should be removed when it is the right time of removing, or what we call extraction. But there are other better ways of conserving, or of how a doctor can make sure these children's teeth remain in the mouth even when they are sick, until the time when they are replaced, their successors, or when they are replaced, when the time to be replaced has come. The last one which I want to talk about that we need to know, ladies and gentlemen, is storage of a toothbrush. When you have family members brushing their teeth and keeping their their toothbrushes in a container, you should make sure, if such as safe as this container should be able to allow water drain out of it. It should be able to allow toothbrushes be very free in them, not so squeezy. And when a toothbrush of baby A is facing this side, or a toothbrush of baby B or of a mother should face this side, so that water or any fluid, any saliva after brushing can freely drain out of the what? Of the blisters. It is not good for you to brush and you just combine all of them by doing this. In case a mother has a dental caries or tooth decay and the child it doesn't have, by doing this, bacteria from the mother will combine with the innocent child's toothbrush and the child will be affected eventually. Ladies and gentlemen, those are some of the few things we need to know about our children's oral health. Thank you so much. Continue, subscribe. You can subscribe, share with other colleagues. We keep learning as we continue on our YouTube channel. Thank you so much.